Why hypothyroidism causes heart palpitations. Heart palpitations are a common and often distressing symptom of hypothyroidism, a condition where the thyroid gland produces excessive amounts of thyroid hormones. These hormones play a crucial role in regulating the body's metabolism, and when their levels are too high, they can have a significant impact on the heart and cardiovascular system. Today, we will explore why hypothyroidism causes heart palpitations, the underlying mechanisms, and how this condition can be managed to alleviate symptoms. Hypothyroidism is a condition characterized by the overproduction of thyroid hormones, thyroxine, T4, and triiodothyronine, T3. The thyroid gland, located at the base of the neck, is responsible for producing these hormones, which regulate the body's metabolic rate, energy production, and overall metabolism. Common causes of hypothyroidism. 1. Graves' disease. The most common cause of hypothyroidism, Graves' disease, is an autoimmune disorder where the immune system attacks the thyroid gland, causing it to overproduce hormones. 2. Thyroid nodules. These are lumps in the thyroid that can become overactive, leading to excess hormone production. 3. Thyroiditis. Inflammation of the thyroid gland, which can cause the release of excessive amounts of thyroid hormones. 4. Excessive iodine. Consuming too much iodine, through diet or medications, can stimulate the thyroid gland to produce more hormones. 5. Medications. Some medications, particularly those containing iodine, can induce hypothyroidism. The role of thyroid hormones in the body. Thyroid hormones are essential for regulating the body's metabolism, which affects almost every organ system, including the cardiovascular system. These hormones increase the metabolic rate by stimulating the production of energy within cells, which in turn increases oxygen consumption and heat production. Key functions of thyroid hormones. 1. Regulating metabolic rate. Thyroid hormones increase the body's basal metabolic rate, which influences how quickly the body converts nutrients into energy. 2. Cardiovascular effects. Thyroid hormones have a direct effect on the heart and blood vessels, increasing heart rate, cardiac output, and blood flow. 3. Nervous system interaction. These hormones enhance the sensitivity of the nervous system, particularly the sympathetic nervous system, which controls the body's fight or flight response. How hypothyroidism affects the heart. When the thyroid gland produces too much hormone, as in hypothyroidism, the excess thyroid hormones can have several effects on the heart, leading to symptoms such as heart palpitations. 1. Increased heart rate, tachycardia. One of the most immediate effects of excess thyroid hormones is an increased heart rate, or tachycardia. Thyroid hormones enhance the sensitivity of the heart to catecholamines, such as adrenaline, which are hormones released during stress or excitement. This heightened sensitivity causes the heart to beat faster than normal, even at rest. 2. Enhanced sympathetic nervous system activity. Hypothyroidism increases the activity of the sympathetic nervous system, the part of the autonomic nervous system responsible for the body's fight or flight response. This leads to increased production and release of adrenaline, which can cause the heart to beat rapidly and irregularly, resulting in palpitations. 3. Increased cardiac output. Thyroid hormones increase the contractility of the heart, meaning the heart pumps more forcefully with each beat. This increased cardiac output is necessary to meet the higher metabolic demands of the body in hypothyroidism. However, this heightened workload on the heart can lead to palpitations and even more serious complications like atrial fibrillation, a type of irregular heartbeat. 4. Changes in blood pressure. Hypothyroidism can cause both systolic hypertension, high upper number in blood pressure readings, and a widened pulse pressure, which is the difference between systolic and diastolic pressure. These changes in blood pressure can further strain the heart, contributing to palpitations. 5. Atrial fibrillation. One of the most serious heart-related complications of hypothyroidism is atrial fibrillation, AFib, a condition where the upper chambers of the heart, atria, beat irregularly and out of coordination with the lower chambers, ventricles. AFib can cause a rapid, irregular pulse, and it increases the risk of stroke and heart failure. The mechanisms behind heart palpitations in hypothyroidism. To understand why hypothyroidism causes heart palpitations, it's important to delve into the specific physiological mechanisms at play. 1. Increased beta-adrenergic receptor sensitivity. thyroid hormones increase the number and sensitivity of beta-adrenergic receptors on the surface of heart cells. These receptors are the target of catecholamines, such as adrenaline, which bind to them and stimulate the heart to beat faster and harder. In hyperthyroidism, the increased number and sensitivity of these receptors amplify the heart's response to adrenaline, leading to a faster and sometimes irregular heartbeat, experienced as palpitations. 2. Increased oxygen demand. The increased metabolic rate in hyperthyroidism raises the body's demand for oxygen. The heart must work harder to supply sufficient oxygenated blood to tissues and organs. This increased workload can cause the heart to beat more quickly, leading to palpitations. 3. Altered ion channel function. Thyroid hormones influence the function of ion channels in heart cells, which are responsible for maintaining the electrical activity of the heart. These channels regulate the flow of ions such as sodium, potassium, and calcium in and out of heart cells, which is crucial for generating the electrical impulses that control heartbeats. In hyperthyroidism, the altered function of these ion channels can lead to the irregular heart rhythms associated with palpitations. 4. Myocardial contractility. Thyroid hormones increase myocardial, heart muscle, contractility, meaning that the heart muscle contracts more strongly. While this can improve the heart's efficiency in pumping blood, it also increases the workload on the heart, which can contribute to palpitations, especially in individuals with pre-existing heart conditions. Symptoms of hyperthyroidism-related heart palpitations. Heart palpitations caused by hyperthyroidism can vary in intensity and duration. They may be experienced as 1. A rapid heartbeat, a sensation of your heart racing or pounding, even when at rest. 2. Irregular heartbeats, feeling like your heart is skipping beats or fluttering. 3. Shortness of breath, difficulty breathing or feeling winded, especially during physical activity. 4. Dizziness or lightheadedness, feeling faint or dizzy, particularly when standing up quickly. 5. Chest pain or discomfort, a feeling of pressure or pain in the chest, which can be alarming and may mimic the symptoms of a heart attack. These symptoms can be exacerbated by stress, physical activity, or other triggers that increase the demand on the cardiovascular system. Diagnosing hyperthyroidism and its impact on the heart. If you are experiencing heart palpitations and other symptoms of hyperthyroidism, it's important to seek medical evaluation to determine the underlying cause and appropriate treatment. Diagnostic tests for hyperthyroidism. 1. Blood tests. Blood tests are used to measure levels of thyroid hormones, T4 and T3, and thyroid-stimulating hormone, TSH. 1. In hyperthyroidism, T4 and T3 levels are typically elevated, while TSH levels are low. 2. Radioactive iodine uptake test. This test measures how much iodine the thyroid gland absorbs from the bloodstream, which can help determine the cause of hyperthyroidism. 3. Thyroid scan. A thyroid scan uses a small amount of radioactive material to create an image of the thyroid gland, helping to identify nodules or other abnormalities. Cardiovascular tests. 1. Electrocardiogram, ECG. An ECG records the electrical activity of the heart and can detect arrhythmias, such as atrial fibrillation, that may be associated with hyperthyroidism. 2. Holter monitor. This portable device records the heart's activity over 24 to 48 hours, providing more detailed information about intermittent palpitations. 3. Echocardiogram. An ultrasound of the heart that provides images of the heart structure and function, helping to assess any damage or abnormalities caused by hyperthyroidism. Managing hyperthyroidism and alleviating heart palpitations. The primary goal of treating hyperthyroidism is to reduce the levels of thyroid hormones in the body, thereby alleviating symptoms, including heart palpitations. Treatment options for hyperthyroidism. 1. Antithyroid medications. These drugs, such as methimazole and propylthiouracil, work by reducing the production of thyroid hormones. 1. They can help control symptoms and bring hormone levels back to normal. 2. Beta blockers. Beta blockers, such as propranolol, are commonly prescribed to manage the cardiovascular symptoms of hyperthyroidism, including heart palpitations. 2. They work by blocking the effects of adrenaline on the heart, slowing down the heart rate and reducing palpitations. 3. Radioactive iodine therapy. This treatment involves taking radioactive iodine orally, which selectively destroys overactive thyroid cells, reducing hormone production. 3. It is a common and effective treatment for hyperthyroidism. 4. Surgery. In some cases, surgical removal of part or all of the thyroid gland, thyroidectomy, may be necessary, particularly if other treatments are not effective or if there is a suspicion of thyroid cancer. Lifestyle modifications. 1. Stress management. Stress can exacerbate symptoms of hyperthyroidism, including palpitations. 1. Techniques such as meditation, deep breathing exercises, and yoga can help manage stress and potentially reduce the frequency and severity of heart palpitations. 1. Diet and nutrition. While there is no specific diet for hyperthyroidism, certain dietary adjustments can support overall health and help manage symptoms. 1. For instance, limiting caffeine and other stimulants can help reduce palpitations. 1. Additionally, ensuring adequate intake of essential nutrients like calcium and vitamin D is important, especially since hyperthyroidism can increase the risk of osteoporosis. 2. Regular monitoring. Regular follow-up appointments with your healthcare provider are essential for monitoring thyroid hormone levels and adjusting treatment as necessary. 2. This ongoing monitoring helps ensure that hyperthyroidism is well managed and reduces the risk of complications, including those affecting the heart. 3. Exercise. Regular, moderate exercise can help improve cardiovascular fitness and reduce stress, which may alleviate some symptoms of hyperthyroidism, including palpitations. 3. However, it's important to avoid excessive exercise, which can exacerbate symptoms. Potential complications of untreated hyperthyroidism. If left untreated, hyperthyroidism can lead to serious complications, particularly in the cardiovascular system. Understanding these risks underscores the importance of timely diagnosis and treatment. 1. Atrial fibrillation, AFib. As mentioned earlier, atrial fibrillation is a serious arrhythmia that can develop as a result of untreated hyperthyroidism. AFib increases the risk of stroke because it can cause blood to pool in the atria, leading to the formation of blood clots. If a clot travels to the brain, it can cause a stroke. Managing hyperthyroidism is crucial to reducing the risk of AFib and its associated complications. 2. Heart failure. Chronic, untreated hyperthyroidism can lead to heart failure, a condition where the heart is unable to pump blood effectively to meet the body's needs. This is due to the sustained increased workload on the heart, which can weaken the heart muscle over time. Symptoms of heart failure include severe shortness of breath, swelling in the legs and ankles, and fatigue. 3. Osteoporosis. Hyperthyroidism can accelerate bone turnover, leading to a reduction in bone density and an increased risk of fractures. This is particularly concerning for older adults and postmenopausal women. Ensuring adequate intake of calcium and vitamin D, along with treatment to manage thyroid hormone levels, is important in preventing osteoporosis. 4. Thyroid storm. Thyroid storm is a rare but life-threatening complication of hyperthyroidism. It occurs when thyroid hormone levels become extremely high, leading to a rapid heart rate, fever, confusion, and potentially heart failure. Thyroid storm is a medical emergency that requires immediate treatment. When to seek medical attention. While heart palpitations can be unsettling, they are often benign. However, if you have been diagnosed with hyperthyroidism, or if you experience any of the following symptoms, it's important to seek medical attention. 1. Persistent or worsening palpitations, especially if they are accompanied by dizziness, shortness of breath, or chest pain. 2. Symptoms of atrial fibrillation, such as a rapid, irregular heartbeat, especially if you feel faint or experience chest discomfort. 3. Signs of heart failure, including significant shortness of breath, swelling in the legs, or severe fatigue. 4. Symptoms of thyroid storm, including high fever, rapid heart rate, agitation, or confusion. Early intervention can prevent complications and improve outcomes for individuals with hyperthyroidism. The importance of managing hyperthyroidism. Hyperthyroidism is a condition that significantly impacts the body's metabolism and cardiovascular system, leading to symptoms like heart palpitations. These palpitations occur due to the increased heart rate, heightened sympathetic nervous system activity, and altered ion channel function driven by excessive thyroid hormones. While heart palpitations can be distressing, they are manageable with appropriate treatment. By understanding the underlying mechanisms of hypothyroidism and its effects on the heart, individuals can take proactive steps to manage their condition. This includes working closely with healthcare providers to monitor thyroid hormone levels, using medications like beta blockers to control symptoms, and making lifestyle changes that support overall health. Proper management of hypothyroidism not only alleviates symptoms like heart palpitations but also reduces the risk of serious complications, such as atrial fibrillation, heart failure, and osteoporosis. For those experiencing heart palpitations related to hypothyroidism, addressing the root cause is key to restoring balance and maintaining heart health.